When you think about what's the worst case scenario when it comes to diabetic foot ulcers or venous leg ulcers, well, it's serious. With diabetic foot ulcers, it could certainly potentially lead to amputation. I'm really struck when I'm talking with my patients the impact their chronic wound has had in their life. They have struggled with this wound, and they've also been on IV antibiotics. They're trying to purchase the right shoe wear. They have a terrible inconvenience of a potentially wet sock, a wet wound, having to do dressing care, sometimes twice a day. More recently, in the last year or two, I've been doing some total contact casting with some of my diabetic patients who have a foot ulcer, and that is a substantial impact. Not everybody can tolerate a total contact cast. Sleeping, you're sleeping in bed with a cast. Bathing, washing, showering, you have a cast on. I have used PICO 7 in other types of wounds and have had amazing results. Wounds such as skin grafts, flaps, something called a pilonidal sinus, and because of my success with those types of wounds, that's why I felt it was time for me to try PICO 7 with the diabetic foot ulcer. It's subtle. It's under the clothing. It's a small device. The patient can continue with their day-to-day work life. It's discreet, and yet I'm still getting negative pressure wound therapy at the wound bed. And I was able sometimes just to have it changed twice a week. So there wasn't the added burden of having daily dressing changes. As a wound clinician, the earlier we can get dealing with what's going on at the wound bed, the sooner we can deal with that. We have so much quicker and better outcomes. So early intervention is really key. I think of a particular patient I had where he readily adapted to the dressing itself, the unit in his pocket, and of course, obviously his wound responded, and he saw that. You see, when patients see the difference in their wounds, it's a real game changer, and so it's a turnaround for them. There is a plethora of products out in the marketplace, and I think we need to be very careful. I think we need to be cost conscious. I think we need to see those good patient outcome results, and then we can begin to consider incorporating that into our practice. Proven technologies are really important when it comes to wound care. I think Dr. Kersner's study, particularly his randomized control trial, that was really fascinating results. I had the opportunity both to read but also to hear him in person share some of his findings. It gave me renewed insight into how wounds heal and how they can heal in a relatively simple, efficient way with a simple unit such as the PICO 7.